so you can draw from your own experiences to impart that to them. And, you know, that's happened as often as if they've taught me from their experiences. That's the other part about being a doctor, is sitting and listening and kind of quieting your mind and listening to what people have to say and go through. I first started backcountry skiing in medical school in New Hampshire. There's a place called Tuckerman's Ravine, and it's on the side of Mount Washington, and so you hike up and you come out at the top, and then you come down this convex slope that you can't see, and so it always feels like you're about to ski over a cliff, and you're not really, but it was very exciting and very fun, and I did it with a couple of friends, and I was kind of hooked after that. Well, as you're coming up, you need to focus just on where you're putting your feet. So it's ends up being very contemplative and kind of meditative, because it's just, you know, 1 foot, where's my next foot placement? Where am I not going to slide back 5 inches every time? And you've got this big load of gear and your balance is off. And so you end up thinking very intensely just about what you're doing, about what your body's doing and how you're keeping your balance. So it's got that aspect of it that's kind of calming. And since you're doing it for hours and hours and hours, it's a nice thing to focus on. I've seen people, you know, once that they'll start exercising in their 50s or their 60s, they lose a bunch of weight, they get off their diabetes medication because the diabetes goes away, they get off their high blood pressure medication. That person's gonna live longer, live better longer, with less medicine and less disease and disability. And that's a huge thing, because no one wants to take pills, and the best way to get off pills is to, you know, strengthen your body and utilize its own capabilities. I find if I try to listen to music, it's very distracting. It's you know, even though I'm not doing anything, it seems to be distracting me from doing nothing, which ends up being actually, I guess, part of the restorative aspect of the sport, is just sitting in and doing one thing and doing it over and over again. And so when you're recommending exercise and you're recommending getting out there and being active, you can do it with some authority, and you say, listen, this is what makes me feel good. And yes, it makes my muscle sore and it hurts and sometimes it doesn't feel good, but you'll be glad you did it. You know, in my line of work, you meet people every age, from younger than me all the way up to people at the end of their life, and they talk about what made their life what it is, the good parts, the bad parts, the things that they would do over again. And if you sit there and listen for a while, then you learn a huge amount about life. People ask me, well, you know, you do all that hiking and then you get very little skiing, and is that worth it? When you earn that turn, it feels really good. And I can remember 10 things about one turn. So having done, you know, 10 or 20 more, it's not bad for August. My name is Paul Cardosi, and I'm a sleep doctor. And if nothing else, I know I'm going to sleep really good tonight.